for today. And I am very excited to introduce to you Hodo Hussein, who is going to present you her results on a study she conducted on the mental and emotional health experiences of doulas serving communities of color, and focusing on their needs and resources. And I would like to take a few minutes to introduce Hodo to you. She is a second-year MPH candidate. She has an undergraduate degree in environmental studies from Pacific Lutheran University and over 8 years of work experience working with underrepresented communities, engaging in community outreach, health education and promotion, and direct services. She's interested in immigrant and refugee health and is passionate about bridging gaps to help establish health equity for all. Thank you so much, Hodo.
Thank you.
You have the floor.
Thank you, Dr. Christina. All right. Hello, everyone. Thank you so much for joining me today for my presentation. So today I will be presenting on a study with doulas, specifically serving communities of color, and we will be exploring their needs, resources, and occupational experiences. Okay, so just to give some background on the study, structural racism is a powerful social determinant of maternal and infant health, and health inequities are fueled by negligent healthcare policies and practices that overwhelmingly impact low-income populations and communities of color. Doulas provide continuous labor support for mothers, regardless of their birthing plan or location of birth, that includes emotional, informational, and physical support. They help their patients make informed decisions and feel empowered to share their needs and resources, as well as serving as a liaison between themselves and medical staff. Doula services have been linked to increased positive birth outcomes for their clients of color and low-income populations. Their services are especially crucial to Black and Indigenous birthing parents who are repeatedly faced with racism both inside and outside of the medical system. Doula care is linked to increased client satisfaction during birth experience, as well as reductions in preterm birth, low birth weight, medical interventions, and cesarean birth rates. However, there is little research on the doula occupation, their experiences, their challenges, and the resources that they utilize to be well, both emotionally, mentally, and physically. There is also little that is known about what additional resources that they need to continue to be well while effectively serving their most vulnerable clients who benefit from their services the most. So this study used a qualitative methods approach to conduct 2 focus groups and 1 individual interview to learn more about the occupational experiences of Washington state doulas that have been working and serving communities of color for at least a year. The study's aims were to explore the everyday occupational experiences of doulas in Washington state who serve birthing parents of color, to identify challenges that present difficulties for doulas in serving their clients, as well as to identify resources that are used by doulas to deal with and mitigate the emotionally and physically taxing work that they do, as well as to finally identify resources that are needed by doulas to better assist themselves and their clients. So the study participants consisted of doulas that were from a variety of different backgrounds, races, ages, and work experience levels. There were a total of 8 study participants whose ages ranged from 31 to 58 years old. 3 of the participants were between the ages of 30 and 33. 1 participant's gender identity was non-binary, and 7 participants identified as female. 3 of the participants identified as being white or Caucasian. 1 identified as African American, 1 identified as both multiracial and indigenous, and 1 identified as being indigenous and Hispanic, 1 identified as being Latinx or Latina, and our last participant identified as Asian. 2 of the participants were independent contractors, 2 participants were both independent contractors and were contracted with the hospital doula program. And 4 of our participants were independent contractors who also worked with nonprofit organizations. The participants' work experience ranged anywhere from 2 to 30 years. And all of these participants have spoken on serving birthing parents of color. And many of them actually focus primarily on vulnerable birthing populations that had multiple barriers to care. So now going into the results of the qualitative study, we will start with the doula's work motivation, their why, what caused them to look into birth work as their vocation. So my study analysis revealed that the study participants were motivated to become doulas because of their lived experiences, their desire to educate and support other birthing parents, and their pursuit of equitable, healthy birth outcomes for all. Some doulas used their own birthing experience as a driving force behind their work because they did not want other birthing parents to have similar negative birth experiences, or they had an unusually positive birthing experience and they wanted to assist other parents in obtaining those same positive birth outcomes. Others expressed that they didn't have the proper information and education when they had their first children. So they wanted to help parents have that proper birthing education that was needed to help them make informed decisions. Some of our doulas also spoke on their cultural identity and their immigration status, being a background influencing their decision to become birth workers, as it was often the norm in their cultures to be provided guidance and support during the prenatal and postpartum stages of maternity. So it felt like a natural calling to also continue that tradition in a professional sense. And I won't read them, but there are some quotes in each of these slides from the doulas. Next, we will look into the doula scope of practices and the services provided. The data analysis demonstrated that the scope of services provided by each doula was nearly limitless, regardless of their professional focus. Most of our doulas expressed that there wasn't anything that they wouldn't do to provide informational, physical, and emotional support to their clients. And the doulas overwhelmingly expressed that focusing on a specific scope of practice and setting boundaries for their services would be contrary to the type of support that they wanted to provide for their clients, particularly those that were more vulnerable, marginalized, or have gone through trauma or substance use. We did have a variety of different birth worker roles. Some of them were birth doulas, some postpartum, some both birth and postpartum. And we also had a bereavement doula that focused specifically on losses. Since every client had individual and unique needs, they often provided wraparound services that included not just advocacy support and assistance, but also education, guidance, and nurturing. And some of our doulas spoke on mothering the mother, so providing those same nurturing and guidance that they would have liked to receive and giving that back to the mothers that they were serving. Next, we will go into our challenges. So the doula spoke on having a variety of different challenges, and these were very significant and impacted their everyday occupational experiences. So one very common challenge that was often coming up within the data was the difficult interactions that doulas often had to engage in within the medical and hospital setting for their clients. Sometimes their clients would come into the hospital with their own doula and their own birthing plan already mapped out, but it was often disregarded or their needs would be ignored. And clients were sometimes even pressured by hospital providers to make choices and decisions that they did not want to, and that was not part of their original birthing plan. Other times, clients may have received misleading and even inaccurate information from their providers. And there was also instances of clear bias where both doulas and their clients were judged based off of their cultural and even religious clothing, as well as their perceived English language capacity. Many of the doulas also spoke on racism and bias. They were driven to work in the birth worker field because they wanted to help birthing parents obtain equitable healthcare and provide accurate birthing information. And so the doulas expressed concern that their clients were facing racism and biases that were often leading to potential negative birth outcomes for their clients of color and those who are more vulnerable. Some doulas communicated that many of their clients faced additional barriers as well as other socioeconomic factors that affected their everyday lives, which added to the stress that they already faced during the prenatal and postpartum stages. The doulas shared that they did their best to advocate and support their vulnerable clients, but it was often challenging to do so when they were faced with racism and bias in medical providers and within hospital systems that were already very hard to navigate for just a regular everyday person. Another challenge that impacted all of the doulas in the study was not being able to receive adequate pay and having insufficient benefits, as well as an overall lack of funding that was available to doulas and their clients. Unless the doula worked primarily or partially for a nonprofit organization or donated their services pro bono, it was challenging to serve hard to reach populations that could benefit the most from doula services due to the lack of financial compensation. Doulas shared their frustrations and feeling of disheartenment because many vulnerable parents had to be turned away if the funds ran out and if they did not have health insurance plan that covered their doula services. So that was a major challenge, wanting to be able to provide and pay their own bills, but also wanting to serve their most vulnerable clients, but having to turn them away many times. An additional challenge that was very interesting that was brought up by several of the doulas was having inadequate parental leave policies. Doulas expressed that the nation's parental leave policy provides parents with an extremely short amount of time to recover after birth, be able to bond with their baby, and also be able to adapt to their new normal while being expected to return back to their daily tasks as well as their job. This has proven to be challenging for both doulas and clients alike, as they are often faced with unrealistic and even often unnatural expectations where a child is expected to sleep through the night or a parent is expected to immediately thrive after birth and juggle everything in their lives with ease, when that is hardly ever the case, according to many of our doulas' experiences with their own particular clients. Another challenge that was brought up was extended work hours. The study doulas shared that they worked extended hours and were often on call all hours of the day and night. And there was often very challenging instances where they would have to prioritize their clients' needs above their own while trying to maintain a work-life balance. Their overcommitment can sometimes be a detriment to their own mental, emotional, and physical health, because they spend so much time with their clients and work so closely with them that there are times where they may experience a traumatic event alongside their client, or have to support their client through a loss, which can have lasting psychological impacts on them. The study participants were continuously demonstrating selflessness by dedicating themselves to their clients and often sacrificing many aspects of their own lives and their own family and personal relationships so that their clients were supported, informed, and remained healthy through every aspect of the birthing process. Now we will look into some of the available resources that doulas shared with us that were beneficial to them. Many of these resources are actually unofficial resources. They're just methods that the doulas have come up with throughout their experience working, which is problematic. So the data analysis revealed that doulas have multiple methods of support. They often are very creative with their use of resources in order to continue to be well emotionally, mentally, and physically. One of the very important resources that they shared as being important to their mental well-being was having coworker support, being able to decompress with their colleagues after a difficult or traumatic birthing experience. And the doulas shared how important it was to have a partnership with other doulas, or to be a part of a network of doulas that could be a resource for one another to get through many of their daily work challenges. The doulas overwhelmingly spoke on how critical it was to be able to speak about their experiences with others who could relate to those same challenges, and how much of a resource it was for them to be able to keep that going. Many of these coworker support resources were unofficial. It was the doulas just calling up their other doula friends or coworkers. And some of the doulas expressed how important it was to create that network of doulas as well. So now we will speak about additional methods and resources that the doulas use outside of coworker support to be able to be well and to perform their work duties. The data analysis revealed that a variety of resources were significant to the doulas because they recognized them as being essential to helping them prioritize their mental health and overall well-being while still being able to be present and meet their clients' needs. Some of the doulas spoke on the importance of seeking mental and emotional therapy services. They also expressed finding enjoyment in spending time outdoors and engaging in physical exercise. And the majority of the interviewed doulas also shared that focusing on self-care acts and having support from and spending time with loved ones, such as family, friends, and pets, were important resources used to decompress. The doulas often spoke about eating well, making sure that they were also treating themselves well, the same way that they treated their clients, and how that was important in maintaining balance in their lives. The doulas also overwhelmingly spoke on working towards not overscheduling themselves and working to set more boundaries so that they could attempt to reduce burnout. Some of the doulas used journals, others wrote things down as a way to process their thoughts and feelings after stressful events and challenging work experiences. And other doulas enjoyed cooking and nourishing their bodies as a form of self-care. So lastly, we will get into the resources that are critical and that are needed by the doulas as being expressed in the qualitative study. So there were many resources that were either missing, limited, or not easily accessible for doulas that they had identified as being critical to their work. Some resources that were brought up was Medicaid reimbursement, having additional grant funding, and finding ways to help their clients pay for services when they could not afford them. Those were the needs that doulas often found difficult to meet, but were essential nonetheless. Many of the interviewed doulas also spoke on wanting access to more trainings and workshops as they helped them build new skills, as well as being able to process secondary trauma that they experience. But they were often just very inaccessible or just too expensive. And many of the participants also touched on how critical it was for doulas to be able to access some sort of official mental health resources, such as therapy or support groups. And other doulas spoke on the importance of having a wide variety of resources that were easily accessible to them, that they could utilize and share with one another, as well as how helpful partnerships and community building resources were to help doulas continue their work and to assist the populations of clients that needed their services the most. So just some recommendations after going through the results of the study. Future recommendations include further research on the birth worker occupation, specifically doulas, because they are not considered to be medical staff that are able to give medical advice for their patients, but that they just continue to provide that labor support before, after, and during. And so their roles, challenges, and resources are often not looked at in the care that they provide for their clients, which is very critical, as well as having additional research on the positive infant and maternal birth outcomes that are associated with doula and birth worker services, particularly the way that they assist and nurture and care for their clients of color that are most impacted by structural racism within the medical system, as well as just having increased access for parents that need it, for doulas, those that can't afford it, those that may not have medical coverage, and maybe those that have language barriers or may not even know what doula services are or how beneficial they may be to their health. Medicaid reimbursement is one of the things that are coming up in the future. We are not sure when exactly that will come into effect, but that is a positive direction that is that we are headed towards in Washington State, as well as creating policy to include access for doula services and all insurances would be appropriate, as well as encouraging or requiring employer-based private insurance plans in Washington state and across the nation. Other recommendations include providing access to funding for training and certifications that are either free of cost, are grant-based, or are low cost, especially for doulas of color or those that may come from underrepresented communities, because they are increasingly needed in this field to assist patients that and clients that could relate to them. Another recommendation is increasing anti-racist and cultural sensitivity training for all doulas, but specifically for white doulas who would like to better understand and serve their clients of color. And I would like to thank all of the study participants, 8 of them. They provided great information and valuable feedback, and this study could not have been possible without them. Also, thank you to my capstone advisors, Dr. Christina, as well as Dr. Kara, and of course to my partner site and my site mentor, Global Perinatal Services, and Faiza Farole. So now I open it up to any questions.
Great.
Yes.
So you had listed one of the needs was further research on the doula population, and you listed some of the research questions. If you had a lovely budget, a research budget, based on your findings of this analysis, how would you design address the research study to address the questions that you?
I think I would start by having a stipend or some kind of incentive for doulas to be able to participate. This study was missing a lot of our doulas of color, our Black doulas, doulas that came from other vulnerable populations, underrepresented populations. And I think it may have been because obviously the doula population within itself is undercompensated, and they're stretched thin with the extended work hours and being on call at all hours of the day and time. And those who are impacted marginally by social structures may not have the opportunity to engage in these type of studies. They may not have the time to dedicate. And so maybe being able to offer them compensation, giving them a budget to be able to provide feedback, and providing additional resources and trainings, and then having them be a part of these research studies, but being able to compensate them for their time because they're already stretched so thin. I don't know if that answers the question, but just one part of it is providing.
That's a critical piece, but also like what the actual study design. What would you do with these compensated participants that are going to yield a very diverse and representative study participant pool?
Well, I think it would probably depend on what type of study it was, like if it was a case study or, in this instance, it was a quality.
You're dreaming it up.
Oh, okay.
All the money in the world.
Oh, okay, okay. Yeah. Well, I think that what I would do then is basically like a case study pool where we would follow the doulas and compensate them for their work, of course, but also give them a budget to be able to effectively serve all of their clients, and then follow them for a period of time to see the outcomes of their patients that they're serving and how that benefits their health. So I think that is what I would like to do. Kind of like a long-term case study where we'd follow them, but also provide them the resources and the income that they need.
Nice. Yeah.
A cohort study, yeah.
Yeah, you would basically be creating the intervention, funding the intervention, and then doing a longitudinal evaluation, right, of your outcomes. Hopefully, let's find her some money.
Hodo, wonderful work. I am excited about all of your findings and the way you were able to highlight resources available and resources that are still missing for this population. And what struck me was the importance of having that partnership with other doulas. Who could help you create these networks of support or these support groups? Who could you reach out to, or who would benefit from reading your report or listening to this presentation to help create that additional support for doulas?
Yeah, I think we could definitely start off with some of the nonprofit organizations that are funding doula services, as well as places where doulas are trained, like the Simkin Birthing Center, the Birthing Justice Center, which was great. That's where some of my participants actually came from in the study, as well as the new hospital doula programs. I think just having a network where independent contractors, as well as those who work for nonprofit and hospital-based doula programs, can all come together, maybe have like a monthly online support group or a weekly support group, or even support groups within their own agency, find time to have that also be compensated, because I know that was just one of the biggest challenges, was just not having enough time in the day to be able to even serve their own clients and take care of their own family and their own needs. And so making sure that they are properly compensated, but also working that into like their budget, their career or work budget, so that they can have time to be able to participate in these meetings or support groups or sessions amongst one another, but on work time, I think would be really important, because that would also encourage them to be able to attend and not feel like they're stretched thin, and be able to decompress and share experiences and gather resources, share resources amongst one another. Because that was one of the things that also came up, was just not having enough resources, or having to kind of salvage what they can find on their own, but maybe having like a collective document or something that they can all go to be able to see what resources were available to all of the doulas in their area or in their county.
That's a wonderful idea for another project, maybe a toolkit.
Yeah.
For resources for doulas. Thank you.
Thank you. Yes.
We have Dr. Delvillar online, who has her hand raised and would like to ask a question. Erica?
Yeah, sure. Thank you. First,
Oh gosh, we can't hear you.
Oh, no.
No. Okay,
Can you hear me
Kristen's on
now?
her way.
Okay.
Thank you. She's
We'll
gonna
see.
figure it out.
She's had lunch, so.
Actually, Anna found it earlier, huh?
Yeah.
And probably actually, then I can find it. Aha, there we go.
Hello.
Hello.
Yes.
All right. Well, thank you. Thank you for fixing the tech side, and sorry to complicate things, but Hodo, I just wanted to say just great work, and it's such insightful work that is much needed. And I'm just excited to see the recommendations that you have. And for me, you tapped into just gaps at different levels, right? I think from the more social systemic level, in terms of what needs to happen legislatively, for instance, when it comes to Medicaid coverage, and then you have the institutional in terms of the hospital partnerships and what needs to go into that, and then the community and the personal. So I'm wondering, given all these recommendations, have you thought about how this, let's say, program of work might look like in terms of short-term, medium-term, and long-term? Because we know, for example, legislative advocacy takes time, and changing Medicaid coverage takes time. So in the meantime, while we're working towards that, what would the short-term intervention look like, or the medium-term? And I think you've responded to this through other questions as well, but thinking programmatically, just wanted to hear your thoughts on that. Thank you.
Yes, thank you so much. I think one of the best ways to start with those kind of smaller interventions would be just the grant funding piece. I know that statewide or even countywide, there are a lot of opportunities for various organizations or specific populations to be able to access these grants. So maybe having a nonprofit organization or even the hospital doula programs being able to actively seek these grants and apply for them, and then use those grants to be able to provide like mental health resources or support group resources, or just additional resources, so that doulas can just decompress and also be able to work with one another. So it's hard to find grant funding, and that's what a lot of the doulas have spoken on, but maybe advocating for county and statewide to be able to provide open-ended grants so that people can apply and then serve the doula population. So I think that's one method, which is still difficult because you'd have to find the grants, apply for it. But I think if maybe doulas wanted to create their own nonprofit organization that specifically was catering to the needs and resources of doulas like themselves, that would be great. So it would have to be people that would want to work on that specific niche and serve the actual doula community versus their clients, which is what they're so focused on.
That makes sense. Thank you so much.
Thank you.
Hodo, I don't know if you can also see in the chat, but Faisa mentioned that she would love for you to present to community-based doula organizations in Washington. And she said, I'd love to reach out to them and invite them if you're willing. This is good info for them all to know, and it can help them get funds to help their doulas.
Yes, thank you so much, Faiza. She was a great mentor for me on this project, and I would be more than happy to present as many times or to whoever she would like me to present to. Part of the reason I did this study was so that I could give this information back to nonprofit agencies just like hers, so that they can, incorporate this information into when they are requesting grants or seeking additional resources or funding for their employees, and not just for the communities that they're serving, but also helping themselves get that help that they need. So I would be happy to share the slides and also present. Yes.
On the side about like scope of work, I was just curious, like I was a doula for 6 or 7 years. I haven't done it again for about 6 or 7 years, but for me as a doula, like I always found like that like my scope of work created boundaries, and like helped kind of like give me some space. So I was curious, like if there was any approaches like that, and then also I was curious, like a lot of times civil work is referred to like, or at least like used to be referred to in the media as like what you would do like medically. So like there was a lot of conversation when I first started about doulas that were doing cervical exams. So I was just kind of curious like how folks approach it now, and like I mean, everyone has somewhat of some scope, even if it's a large scope. And I was just curious if you were able to delve more specifically into that.
Yeah, we kind of touched on scope because it was very specific to each doula's like particular population that they serve. So some of our doulas, because they were serving more vulnerable populations that had all of these barriers, like maybe they've gone through sexual assault or substance use, they're battling substance use or domestic violence even. Those clients often need more delicacy and like additional support, possibly outside of the hours that they would normally be servicing their clients. So those are the doulas that spoke on kind of throwing scope out of the window and like switching all of their different various hats. That quote from one of our doulas was actually how she believed that she was a mixture of a social worker, a care counselor, childbirth educator, traditional birth keeper. So she was just switching all of these different hats to adapt and serve her clients. And that might have been, you know, looking for social service resources or taking her client somewhere outside of just the birth work. So those are often the birth workers that are stretched thin, but there are also birth workers that were interviewed that were not birth doulas. So they focus more on, you know, food and nutritious services, educational information. So I think because of the variety of doulas that were interviewed, it was difficult to like pinpoint specifically what they would or wouldn't do because they were just serving so many clients in need. And so they often felt that if they were setting all, they wanted to set boundaries, but if they were setting these boundaries, they wouldn't be able to properly serve the clients that they were assisting because they needed so much assistance and they wanted to help them access all of those different resources. So I didn't hear anything about cervical exams, but they were definitely doing above and beyond their scope. So, and I think that kind of goes to show like just how emotionally connected they are with their clients and how they want to help them, even if it's outside of their services. Thank you.
Just because we went through this with the midwives, I think part of what makes doulas amazing, right, is exactly what you're saying. If you are presenting to a hospital group, you might want to think about the underutilized that word scope is really triggering for people. When really what you mean is they're like going above and beyond the call of duty, or I'm not saying you should say it that way, but there might be a word that would be less triggering for people.
For medical people.
For medical people, if that makes sense. Because you're probably not mostly talking about, like you said, surgical exams, right? What you're talking about is the social work, the, you know, all of the things that people need.
Childcare and
Right,
navigation and connection with resources and.
mental health and all of that, so really awesome job. It's what makes a doula, you know,
Right.
is that they're willing to step in and yeah, it's exciting. I have a one of our alumni would probably love to have you talk as well. She is at Valley Medical Center.
Oh, Sarah.
Yeah, don't you think that would be great?
Sarah.
I bet Sarah would love to have you come talk.
Okay, yeah,
as
I'd
well.
love to do that. If it's helpful, I would love to share the information, of course.
Yeah,
Yeah, it's just so hard to, and you know, I had a lot of other doulas that were willing to participate, but it was just the timing conflict. They were being called into births last minute after, you know, saying that they might be able to make it. So it would have been great to have more participants. So I think that was one of the limitations of the study, but even with the few participants that we did have, because it was qualitative information, there was just so much great information captured, even with just 8 participants. And I'm sure they would have probably uttered the same sentiments if we had gotten, you know, more doulas. But I think having also maybe more doulas of color would have been great to see like what challenges they themselves were experiencing as along with navigating the challenges of their clients. And a lot of the doulas did speak on how, although it is becoming more diverse, it has mainly been overwhelmingly white doulas serving people, especially those who are more middle class. So I think it's great that we're having Medicaid reimbursement sometime in the near future. That's really exciting.
It's been the talk for a long time, so hopefully it happens. So probably I started hearing conversations about it probably like a decade ago. And now with like the Swedish doula program, I feel like it's gotten us a little bit closer to that, just because like, I think when you're like systems, right, like healthcare systems like to see samples of things that are working within the system that they trust or whatever that they kind of control. Right, yeah.
Yeah.
Well, the law definitely passed, so it's in the RCW, it's gonna happen. The question is, what will come out of the wax in terms of how much money they're gonna get? That's what you mean,
Yeah,
right, right.
Yeah.
And it's kind of a race between Washington and California.
Yeah.
California might be Washington on this.
That was a whole conversation like years ago when they were talking about like the hospital program and Medicaid. It's like, I mean, they were talking about like $300 or something. It's just like, why bother? What?
It was like 250 when Sophia, but Sophia was like, it's so important, we're gonna do it, and then they finally have changed it to what now?
It's like 17 years. I mean, it's
That's-
shot up a lot, which is great, but
Yeah.
for a long time. It's
Right, and it takes, I mean, and I think a lot of times people that like are like us that are like accustomed to like medical systems, like the billing process and like how do you actually go through the reimbursement and then like are you fighting with this like with the reimbursement system to like actually get paid? You know, they're like, well, this didn't happen, you didn't like check this box. Like I wish that it was like a more like holistic system where like like they actually believe in the value, like they can actually see like, oh, this like lowers cesarean rates, this, you know, like lowers intervention rates, like it costs us less, there's less lives lost, like it's so weird that it's like, but we have all the proof of it, but like it's not real to them.
It's on the scores because it's been proven that it's cheaper.
Right, yeah, totally. It's like Charlie was talking about, like, sometimes cheaper comes first.
They're like because of C-section costs more. C-section costs more, but Medicaid pays, you know what I mean?
The same. In Washington anyway, not.
But because if they move back in the military, they get paid less.
And
So
it's an
they get
incentive.
their full amount for Medicaid is to do a C-section.
But not here in Washington, they made it the same, they pay them the same, and pretty much overnight, the C-section rate went down.
Oh, to not incentivize.
Wow.
Right, they took away the financial incentive for doing C-sections.
Oh, right.
So in Oregon, do they have to be like certified
It's
or?
always still like some certified, but you do have to have some sort of.
Any other questions?
Your topic is obviously really important and we're so grateful that you did this work.
Yeah,
Yeah.
thank you so much for allowing me to join and present. All right. I think that's it. Thank you.
Thank you.
Thanks to those who have come for our presentations today, our students' presentations today. Of course, I can't even see the, that is the end of our presentations, but if you're not already familiar with our programs, please let others know. I just heard a word recently, a public health word, I guess, because I heard it from someone who works in public health, and it's called up-credentialing. And it sounds terrible, and I would love to hear what Dr. Good has to say about even just the word up-credentialing. But I've been thinking about it a lot because it's a part of what our program does and offers, right? You do not have to have a bachelor's degree to come into this program, right? You have that life experience. Maybe you've been working in your community for 10 years. You have done, schooling, but really it's about this opportunity for people from their communities who are already doing this good work, transforming perinatal and postpartum systems where they already are, to actually get those letters behind their names, to do amazing projects like these students here that will make an impact. And so that's what our maternal child health systems program is for. We have a master's in public health degree as well that's accredited. All of them are regionally accredited. And it's just so exciting. And of course, we have our clinical midwifery program for those of you who do want to do cervical exams. So thank you so much for being here with us today. It's been a real pleasure, and we'll get the recordings out at some point as well. Oh, yes, Dr. Taiwo, please.
Oh, yeah, and I just want to especially give a thanks to our incoming MCHS students who have hung in with us all day. And Dr. Del Villar, who was here with us in person and then joined on Zoom while doing Saturday Kids stuff. And also Karen Hayes, one of our founders of the program who's been here with us all day. So I just really wanted to call out a few people. So,
Very much so. And Dr. Anderson,
Yeah.
Nancy Anderson was here earlier. Hi, Karen.
looking forward to seeing our students in a month on campus.
Right.
Yeah.
Before we know it, less than a month. Yeah, feel free to unmute. Thanks, everyone. Great to see you.
Thank you. Amazing work, everyone. Thanks.
Yeah. Bye-bye.
Yes.
Yeah.